Hello there. Hi, everyone. Welcome to Monday. It's October 19th, a beautiful start to this week. The weather's just so nice outside. I know we're all enjoying that after a couple months of seemed like rain and endless threat of hurricanes, and we're not out of the woods yet, so keep your go kit packed. So my name is Rundy Murphy. I am the Director of Disease Surveillance here at the Mobile County Health Department. I'm here to give you the 2:30 Facebook Live update on the impact of the COVID-19 epidemic on Mobile County and our residents, our businesses, our visitors. So around the world, we have reached 40 million cases of COVID-19 disease globally, with around 1.1 million deaths. Again, globally in the U.S. and the state of Alabama and in Mobile, we're seeing around 2.5% of the people with COVID-19 pass from their illness. In the U.S., we have around 8.2 million cases of COVID-19 disease, with nearly 220,000 deaths. In Alabama today, it's 173,484 cases of COVID-19, with 2,789 deaths. In our daily COVID report that is done in collaboration with the SSI group here in Mobile, I'm so grateful for their continued support, pro bono support of our daily report, and we couldn't have done this without them. So today we're reporting on 14,322 cases of COVID-19. Just 11 cases were added yesterday, Sunday. We generally see a rather low number of cases reported in the following a weekend. On Saturday, 54 cases were reported, and on Friday, 63 were reported. So again, 14,322 today. 316 have died with COVID. The cumulative number of hospitalized with COVID is 2,182. 5 were added yesterday. And yesterday, the number of people hospitalized with COVID-19 in Mobile County hospitals was 74. I'm glad to see that we've gotten back down in the 70s on a regular basis with the number of people who are in the hospital with COVID-19 on any given day. So our expanded report came out today, the one that we publish just each Monday, to give you an idea of what things are looking like over time and provide some more information than our daily report on hospitalizations and deaths. So again, our rate of COVID-19, so adjust for the population so that we compare ourselves to other counties and other states. We have 3,454 cases of COVID-19 for every 100,000 people living in Mobile County. Again, we continue to remind folks that there's a greater increase of COVID-19 transmission in younger age groups than in the older and very young. So whereas on average, or for everyone combined, our rate is around 3,500. For people who are between the age of 18 and 24, it's nearly 5,500 cases per 100,000 people. And for people aged 25 to 49, it's just over 4,000. So again, just wanting to remind you all that our transmission is being driven, our outbreak is being driven right now by those younger age groups. The 18 to 49 age groups accounts for more than half of our COVID cases overall. And that 18 to 24 age group particularly, there's been a 69% increase in case reports in that age group, 18 to 24, compared to all other age groups. So we are starting to see the number of COVID cases reported to us inch up slightly. I think for us, it's around 4%. This past week, our expanded report is showing 329 COVID cases reported last week. That was a 4% increase from the week before, when compared to the week before. In Mobile County, it's jumping up and down a little bit over the last 4 or 5 weeks, still much lower than we saw in the summer. We're very happy about that. So continue wearing your mask. But those younger age groups that maybe aren't as compliant with mask wearing or physical distancing, really, I hope that they will listen up and try to help us continue protecting our community, because we are, nationally, we are starting to see the number of cases tick up. Let's see, already mentioned about um, having more transmission in the younger age groups. We are still seeing that, more women, a greater percentage of women, greater percentage of our cases are women compared with men. That's been similar from the beginning, in that, in general, women are more likely to seek care than men. 2 times the rate in African Americans is twice that of their white counterparts. Again, something that has been recognized fairly early. We are averaging now, over a 14-day moving average, about 40 cases per day. If you sort of try to average out the noise and look at a 7 or a 14-day trend, and looking at a 7 or a 14-day moving average of the number of hospitalizations, we're seeing about 70 per day. For those that are hospitalized, the really good news, I mean, there's not anything new here, but it's been interesting, and we are thankful that the very young don't seem to have severe illness or complications. In fact, in children under the age of 18, they represent only 1% of our cases. So we've just had 19 people in Mobile under the age of 18 that have required hospitalization. And if we look at those under the age of 25, it's only 3%, so around 60 or 61 cases hospitalized. So we know that children and youth and young adults are likely to have asymptomatic infection or very mild illness. Something up to 40% of people who are infected and infectious to others may have no symptoms at all and not know that they are infectious. So again, all of the data behind the recommendation to please continue physical distancing, wearing your mask, washing your hands, disinfecting high-touch surfaces, those different things. The number of emergency department visits for COVID-like illness is trending up a little bit, but thankfully the number of deaths is still pretty low. About deaths, remember that deaths are more likely in our older populations, or those that are 65 and older. So the people who are 65 and older, the death rate among them is 15 times greater that of other people who are under 60. So it's really important for you to take care of yourself if you're older or if you have underlying medical conditions. And then looking at our laboratory data, we had a good number of laboratory results reported to us again last week, around 6,000, with just 4% of those being positive. Again, the low positivity rate, or the low percent positive of our laboratory results, is good, but we know that the data that we get through the traditional public health system may be somewhat skewed, because we primarily get PCR test results, and many of the antigen tests that are going to nursing homes and urgent care centers, we are still trying to bring those into our surveillance system. And people who are sick or think they might have COVID truly after an exposure may have a greater tendency to seek a rapid test result. So we know from some of our partners in the community that are doing rapid testing at public and private sites, that the folks doing those rapid antigen tests are seeing a higher percent positive in their results than we are seeing through traditional public health. Some of them are seeing 12%, some 14 or 15, much greater than we're seeing through traditional public health. And as I mentioned Friday, nationally, the Centers for Disease Control are working to try to work with the manufacturers of these point-of-care tests, or these rapid test machines, to try to get those results. And our state health department is working with testing facilities to try to help them get on board with reporting test results as required by law. So the hotspots geographically, still seeing a lot of transmission in the last couple of weeks. In the the sort of center part of the county, 36608, 09, 36693. We've sent letters to some of our colleges and universities where we see clustering in housing complexes around colleges and universities. So we want to get the message to the young folks who are driving our outbreak as best we can. All right. I just want to remind you, I like to revisit the symptoms of COVID every once in a while, just to remind people that, in the beginning of the COVID outbreak, we were saying if you have fever or shortness of breath or cough, please go get tested for COVID. And now the symptom list is quite a bit longer. And I have said from many times before, if you don't feel well, if you feel like you're just not quite feeling yourself, please seek a COVID test. You can get one at the health department if you need to by calling our appointment line 251-690-8889 at no charge to you, and you don't have to have symptoms in order to get tested. But here are the symptoms that may appear from 2 to 14 days after exposure. Fever or chills, cough, shortness of breath, those are still in there, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Now, if you have school-aged children out there, K through 12, you know that at the start of school season, they're going to have intermittent fevers, they're going to have runny nose, they're going to have upset tummies, all of those things. So for school children, really we're focusing on that new loss of taste or smell. But for the rest of us, any of that list of symptoms could be caused by a COVID-19 infection, and please get tested. And if you have COVID-19, you should watch for emergency warning signs, right? If you can manage your illness at home, that's what we want you to do. But some emergency warning signs that would prompt you to seek treatment is trouble breathing. They are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. So please try to manage your illness at home, but don't hesitate to seek care should you have some more serious conditions that need emergency care, because particularly if you are older or if you have an underlying medical condition, then we want you to seek care to avoid severe complications or death from COVID. All right, just two things from Facebook from Friday. We talked on Friday about why the fact that wearing a mask is not required at polling locations for the November 3rd election. So there is an exemption to mandatory face covering at polling stations. You are not required under the Safer at Home order to wear a mask at polling stations. However, that doesn't mean you shouldn't wear a mask. The reason it's not required is that legally we cannot put anything between you and your right to vote. So requiring someone to wear a mask who maybe doesn't have a mask or can't afford a mask really is, could potentially limit someone's constitutional right to vote. And we want as many of you to vote in the November 3rd election as we can. Friday and going forward over the next couple of weeks, we'll be trying to prepare you with how to stay safe at polling locations and also how to stay safe at Halloween. So again, just because it's not required that you wear a face covering at polling, you still should wear one if you can tolerate it and if you have one. And the polling locations will be doing everything that they can do to keep you safe, but just follow those same guidelines. Wear a face covering, stay 6 feet apart from people while you're in line and while you're casting your vote. The other comment on here, not really much of a question, but someone commented that they have very little trust in COVID tests. You can maybe get one test at this location and it's positive, and you test someplace else and it's negative. And there seems to be lots of people out there who have conflicting stories about, a test, discordant test results or those that don't match in a short period of time. So a couple of things about that. If it's a PCR test, if it's a molecular test, if it's the test that has to be done at a highly complex lab or the one that can be done at the point of care by the Abbott machine. These are molecular tests, PCR tests. They are very reliable tests, particularly if you have symptoms of COVID. They are super, super reliable. So if you have a molecular test or a PCR test, that is really the gold standard in this situation. The antigen tests are likely to be very reliable if you have symptoms of COVID, right? They are most reliable when they're used in the diagnostic setting appropriately. But you can sometimes get a false negative result on an antigen test if it's not used in the proper situations. So if you're not likely to have been exposed to COVID, you have no symptoms of COVID, then, a negative antigen test, or you may get a false positive antigen test, and that's something that we want to try to avoid. So if you are asymptomatic and you haven't been exposed and you have a positive antigen test, then we may have reason to reflex you or test you again using a PCR test. But these are incredibly difficult decisions to make. Many people don't even know what type of test that they're getting when they go to the doctor's office or to the urgent care. So please try to avoid sort of test hopping, getting tested here and there and someplace else. If you do get tested on multiple occasions over time, try to get tested at the same location. Try to do it under the guidance of your healthcare provider. If you have questions about it, you can call us or me. We can talk you through those things. But again, the molecular or the PCR test, highly reliable. But on the antigen test, in general, if you are sick with COVID, you've been exposed to COVID, and you test negative on an antigen test, we would want you to get a PCR test to follow up. And if you are asymptomatic and have not been screened or not have been exposed to COVID, and you test positive on an antigen test, we might think that is a false positive, and we might recommend following that up with a PCR test. But remember, once you test positive, you really should sort of halt testing, isolate for 10 days, and then discontinue isolation based on that 10-day period. All right, a couple other things to mention. The Unified Command, so this is the COVID Unified Command that's been in place since very early in our outbreak. They include the Mobile County Health Department, the Mobile County Commission, and the City of Mobile, and they have put out a news release to and continue to promote wearing a face covering, frequently cleaning hands, and practicing social distancing. And they also encourage citizens to be as healthy as possible to help fight off viruses such as COVID-19, flu, and other infectious illnesses. I think everyone knows that the South, and Mobile County included, often is sort of top of the list of many comorbidities, obesity, heart disease, diabetes, those sorts of things. And so we really, not just wearing a mask and washing your hands, it's going to protect you from COVID and other viruses, but just trying to maintain a healthier lifestyle will improve your overall health and improve your overall immunity. So please continue to have a balanced diet, exercise, manage your medications, all those things to do to try to stay healthy. A couple other things. Wanted to say a big thank you to the International Medical Corps and their disaster relief partner, Bloomberg Philanthropies, who donated 250,000 KN95 masks to 4 locations fighting COVID-19 in underserved areas of Alabama and South Carolina, including the Medical Society of Mobile County in Alabama. And so of these masks that were donated by these philanthropic institutions, some of them were donated to agencies throughout the county that will be able to get those in the hands of the most underserved populations. So all distribution locations in Mobile County, of which MCHD was a recipient of part of that donation, plans to distribute masks to the populations most in need in their communities, as well as to bolster the community health support already provided by the health department and the medical society. So again, the health department really wants to thank the Medical Society of Mobile and Dr. George Koulianis, who is their director, and particularly International Medical Corps and Bloomberg for donating those KN95 masks so that we can distribute those to our minority populations and those who are most vulnerable and need a little help every once in a while. So we are looking forward to planning some events to distribute those masks, including Halloween is coming up. You may have heard that the Mobile Parks and Recreation, along with Blue Cross Blue Shield, the health department, it looks like Cigna, the police department, the fire department, lots of agencies teaming up to have a drive-through trunk or treat on October 31st at Langham Park, and it'll be from 10 to noon. Keep the kids in the car. There will be adults as you drive through to provide goodies, and it sounds like it will be a good thing. Wear your costumes, decorate your car. I think they're going to have a car decorating contest, and participate. This is a really good and safe way to carry on the fun of Halloween while preserving the health of our children, but more importantly, keeping our children from becoming infected with COVID-19 and potentially carrying it back to their parents or grandparents or aunts and uncles that might be subject to more complications. So we'll be talking more about this throughout the week, how you can protect yourself and others from COVID-19 during the Halloween activities. Don't let children grab directly from the candy bowl. So, pass out treats directly to trick-or-treaters, maybe have them bagged and maybe, sitting on your porch if you are going to open your door. Sanitize hands thoroughly before passing out treats or to trick-or-treaters. Don't pass out homemade treats of any kind. And again, adults should be the ones handing out treats and should be wearing a face covering, practicing social distancing, those sorts of things. I've also seen some stuff by CDC about being careful about hand sanitizer that might look like a beverage. We want to make sure that children don't confuse cute little bottles of hand sanitizer with a drink. So be very careful about that. And we will continue to share some things on social media that we have, sort of encouraging you to, if you are going to have gatherings, have them outside. Make sure that you can maintain that 6 foot of distance. And again, we'll continue sharing some important tips with you this week through our local media partners and again on Friday and next week. So with that, I will stop in today's update, and we will talk to you again on Friday about the impact of COVID-19 on Mobile. Stay safe and be well out there, everyone.